Ever wondered what to do when you suspect a broken bone? Imagine this. You're out hiking with friends when suddenly one of them slips and falls, landing awkwardly. You rush over and it's clear that they're in pain. Could it be a broken bone? Any injury to limbs, hands, and feet should be treated as a potential fracture until confirmed otherwise by an X-ray. While broken bones do need medical attention, not all cases require an immediate emergency trip to the hospital. There are first aid steps that can help stabilize the bone until professional health care can be accessed. In cases where someone is bleeding profusely, unresponsive, not breathing, or has multiple injuries, emergency medical care is necessary. Dial 911 immediately. Similarly, if a suspected fracture involves the spinal column, head, hip, pelvis, or thigh, it's crucial to avoid moving the person and call for emergency help. If a broken bone is visible through the skin, or if the area below an injured joint feels cold and clammy or appears bluish, also seek immediate help. However, if the situation isn't as dire, there are steps you can take to provide first aid. First, resist the urge to straighten the bone. For a limb, use a splint and padding to immobilize it, then elevate it. Apply a cold pack to the injury, but not directly on the skin. Always use a barrier between the ice and the skin to prevent tissue damage. If all that's available is ice, place it in a plastic bag and wrap it in a shirt or towel before applying it. To manage the pain, administer anti-inflammatory drugs like Advil or Aleve. While some studies suggest that these non-steroidal anti-inflammatory drugs can slow bone healing, short-term use appears to have little or no effect on the healing process. To summarize, in a suspected broken bone scenario, the key is to stabilize the injury, provide pain relief, and then seek professional medical help. In cases where the injury is severe or involves critical areas like the head, spine, or large joints, immediate emergency care is necessary. Remember, it's always better to err on the side of caution when it comes to potential fractures. And remember, you can talk to a doctor anytime, anywhere with Truemed.